Good morning. Welcome to this particular function. We're coming to you live from the Safari Park Hotel, today being the second day of February 2023. An important day in our calendar where the world is marking the World Cancer Day, and here in Kenya we are also marking the Cancer Summit 2023. I hope you are going to enjoy the discussion. I have my guest already on set. We want to talk about matters, health and cancer. Do you know your status? Even your kin, do they know their status? One of the leading causes of death right now is because of cancer. Reason? Because of early, late screening, and that is one of the issues that we want to discuss here as a nation so that we can get informed. You go get screened and tested. Welcome to the program. My name is Victor Oloo. Right about now, I have got my guest in studio already. I have got Dr. Githinji Gitahi, who is the Group CEO, Amref, and Chair, National Cancer Institute Board. Doctor, welcome.
Thank you very much.
Karibu sana. And in the middle, the only lady here is Dr. Nyongesa. Dr. Nyongesa is an oncologist who is was likely put, cancer specialist and head of department, Kenyatta National Hospital, cancer treatment. She also has over 15 years in management matters cancer. Dr. welcome.
Thank you so much for having me.
And so to speak, we were making fun out of it. We are safe. Matters health and we matter security. We have Chief here, who is Douglas Kimani Mwangi, who is the Assistant Chief, Kahawa West Sublocation in Kasarani. This is your area, right, Chief?
Thank you. This is my area. Welcome.
Karibu sana.
Thank you.
Thank you so much.
Thank you.
So, gentlemen and lady, let's talk about cancer today. Today being an important day in the calendar. Let me start with you, Dr. Githinji. It's coming at a time when I quote you, you said in a past event that 76 people die daily because of cancer. That is a big number.
That's a really big number, and we estimate that that 75, 76 actually underestimated.
Yes.
Because of course the source of that data would be what we call the National Cancer Registry, or estimates, or what you may call projections from the global data. We know that there are a lot of people who actually die of cancer, but they never really access a health facility.
Yes.
Meaning that therefore they may not be recorded. Because of course we know that access to health services in this country and many other countries in Africa is only about 40%. Yes. Only about 40% of people have access to healthcare. But that as it may be, it means that we are losing 75 lives every day, 75, 76 lives every day. That is 75, 76 families that are affected on a daily basis, and that amounts to more than 27,000 people on an annual basis. The challenge actually is not even, it's more about why is it that we are losing so many people, and how many are actually being diagnosed at the same time, because the 75 is daily deaths. We estimate that about 115 diagnoses are made on a daily basis, which tells you that if you're making 115 diagnoses every day and 75 or 76 are dying every day, that's a very high ratio of people who die out of the ones who are diagnosed. And this is actually the challenge, and this is what brings us here today, because you may get cancer, but then if you're diagnosed early, then you don't have to be a statistics within the 75.
Yes.
So the big challenge for us is how to reduce the burden of cancer overall, so that we don't diagnose so many people on a regular basis, which means prevention, but also how do we diagnose them early for those who actually eventually get it, so that we're able to save their lives, which is the work of Dr. Nyongesa and her team, to say we do early diagnosis, and then for those who do early diagnosis, then the chance of survival is significantly higher.
Yes.
Which is really the question we are asking. How do we ensure we downstage, we diagnose people early so that they have a chance of survival?
That brings me to my very important question, that how important is this day then?
So today we are in the National Cancer Summit. On Saturday, we are celebrating the World Cancer Day. So this period, today, tomorrow, as we discuss the matters cancer, we are also leading to this International Cancer Day. The importance of this is that number one is we must get together as a country, all sectors involved, because cancer is not purely a health sector issue.
Yeah.
There are issues around, when you talk about prevention, you're talking about agriculture, because you know that the storage of grain, for example, is significant significantly important for cancer prevention because we know that there are certain chemicals like aflatoxin that may lead to cancer. We need to talk about the National Environmental Management Authority because pollution can lead to cancer. So today and tomorrow, we are actually bringing all stakeholders who are involved or may be involved in reducing the risk of cancer. Number two is we are bringing stakeholders, and this is why I'm really happy to see the chief here, who are community leaders, because we need to create awareness about how to prevent cancer, but also how to ensure that people can go for early screening. You know, people in the communities, the awareness on cancer screening is very low. It's probably less than 15%. So we need to push that up so that people go for early screening. We then need also to think about the management of it. When you do early screening, who pays for the screening? So we need NHIF, we need the counties here to say, how do we finance early screening? Not only provide for mechanisms for treatment, but how do we provide the necessary financial muscle, the health workforce that's required to do early screening and the awareness. So we need everyone here, and this is why the National Cancer Summit is really the critical moment for us to develop a blueprint or a beating cancer plan that we can all rally behind so that we can reduce this burden of cancer.
Absolutely. Yes. And coming to you, Dr. Catherine, you know, as the head of oncology and the head of Cancer Treatment Center at the KNH, that is one of the biggest centers and referral hospitals in East and Central Africa. Perhaps the numbers that you receive on a daily basis for screening, it paints a grim picture of a nation that is not aware of the state of cancer as we speak currently, based on what Dr. says, that cancer can be brought even from aflatoxin, that, you know, it's about lifestyle, what we go through. Anytime you receive a patient, what do you really see in them?
So thank you so much. Cancer is really a major public health care problem.
Yes.
And when I sit at the Kenyatta National Hospital, we unfortunately see many of the patients presenting in late stage. And this is because of barriers in navigating the healthcare system. And I am happy to say that with devolution of health, we want the counties to be more strengthened in terms of managing cancer patients.
Yes.
This will help in early diagnosis and timely treatment before they reach to the national referral centers. Kenyatta Hospital is a national referral center, so which means we are looking at getting only cases who need more specialized advanced care, and other basic care for cancer patients can still be done in the counties, and this is going to be achieved by more training of doctors, forums like this talking about what are the common signs of the cancer, what should people look out for, what are the risk factors like use of tobacco, alcohol. People don't know that this can lead to cancer. Even some infections like human papilloma virus, this is a preventable disease. We are encouraging mothers with young girls who are the age between 10 to 15 to take their girls for immunization at the county hospitals. It is available for free. Cervical cancer, I would say, is the #1 leading cause of death in our women, and this followed by breast cancer. And these are diseases which can be picked up early and can be managed, and cervical cancer is a preventable disease. So we say that over 60% of the patients are women, and 40% are of the cancers are being reported in men. We don't know whether this is a true reflection that cancer in our community is more common in women, or is it that the women have a better health-seeking behavior than the men in our community.
Does it really paint a picture of people are not aware of their state of health in the communities where they live, and the fear of getting tested and found positive is now what is now holding people back?
Cancer has a stigma, a lot of stigma, and if you look through the patient navigation program at Kenyatta and just looking at the routine data, we see that many patients have fear, they worry, they also worry about financial implications of the cancer. So, and just the fear of just the fact that you have cancer. people look at you like you are going to die tomorrow.
Yeah.
But I'm here to say that we have cancer patients, despite all those grim statistics, we have survivors. And that is more encouraging, that people should not fear coming forward for if they have symptoms for treatment, and if you can also go for screening in case there are signs of cancer. It can be picked up very early, and sometimes prevention can be done.
Of course, I'll come back to the matter to do with the stigmatization and the health, the financial implications that come with it, because cancer is very expensive. Yeah. But Chief, we are in your locality. Thank you for welcoming us. But as administrative wing of government, what are you doing deep down in the in your level to create that awareness that yes, cancer is there, it's one of the leading causes of death currently in Kenya, but we can prevent it?
Thank you. I would say that as a ministry, we are arrived and up to the task to handle challenges at the community level, at the grassroots agents of change. We are in touch with the community, with the health facilities, with the health providers. I would say that one of the biggest challenges is the myths and misconceptions about what causes cancer, how it is treated, and how about priority of health in life. And the people are challenged with so many problems that they don't want to put health as a major important investment. And I would say that they now relegate matters health to myths, cultures, and beliefs, and misconceptions. You'd see that one of the challenges we have is that at the onset, what causes cancer is a dispute to the common mwananchi. You'd find what goes in the street is that when you take wheat, it will cause cancer. So they think you are not taking wheat, I'm not under the risk. They also would think that because I'm in a family whereby no one has been tested positive with cancer, then I'm not at risk, so I will not even go for screening. And when it comes to issues like vaccine, like the HPV, they would say that this is a Western way of controlling African population. Yeah. So if you go for vaccinations, you go for vaccines, then it is more of a family life, a family control.
Yes.
And you realize that they detest it, they ignore it, they think it is not unnecessary. They would also maybe believe what is peddled in the social media. And what goes around is what even they believe is gospel truth. They would say that cancer is caused by phones. If you sleep with your phone, then you are likely to get cancer. Yeah. They would say then maybe it is caused by it's a disease of the rich, because they are eating a lot of meat and red meat and all that. That is what causes cancer. And you'd realize that they not actually know what is the cause, how to prevent the interventions, and that you can survive. Then when you get it, they say it's witchcraft, umerogwa, and you end up even finding someone, they are consulting very small pastors at the back street for prayers. And they don't get assisted. They don't go for screening. They don't go for treatment. They go for intervention. And they also think it is very costly. So they ignore it and leave it to God. And that is one of the challenges. But we are bringing in community health volunteers. We are bringing public health officers, community health officers who will be able to educate the community, to bring them on board so they can understand they need to go for screening. We have a head event with the Kenyatta University Treating Hospital, Kutri, at our area. They do regular breast cancer and other cancer screening, and we've seen community interested now going for screening, including men who didn't believe that they can get breast cancer. They now go for screening. They didn't believe that a man can get ill. They will only go to hospital when they are highly invalid. So we are seeing change, and with various level 1, 2, 3 hospitals at our area, we see a change.
Absolutely. Dr. Gitahi, based on what Chief has said, you know, that is just but a very small representation and a picture of what's happening nationwide, because with the misconception, with the myths, perhaps those are some of the reasons that holding people back. I have to consult my spiritual, figure somewhere for me to get healed. And then the issue of stigmatization. Based on what Chief is saying, do you really think these are now some of the reasons why we have got late diagnosis about cancer? People are not aware about their status. And how can we change the whole narrative?
Yeah, Chief Douglas has made some really important points around community mobilization, the stigma around cancer, which also Dr. Nyongesa talked about. I think the first problem we have is awareness about cancer, about screening. Just to say, why should you be screened? Because people are used to going to the hospital or to the facility or even to seek care only when they have a problem. When you have pain, when you have bleeding, when you can't eat, that's when people go. When people are okay, in their own definition, they are healthy, they don't go and seek care. And screening is asking people who are healthy to actually go and seek screening so that they can be found whether they are having a problem. And this is not only for cancer, it's also for hypertension, diabetes. But we know that people, because of this fear and stigma, they say, I would rather not know what I have, because then if I know, then I'll be worried. So they rather bury their head in the sand. And this, you leave it. Because then when you're told you have cancer, then there's a new problem that you have to solve, which you didn't have to solve before because you have no problem. But this is the reason why our people are coming late. But also, we also know, and Dr. Nyongesa can probably confirm this, that a lot of the people who come in late diagnosis have actually been to the health center, they have been to a health facility. I saw some data that was saying that a lot of the people who come to the hospital, finally by the time the diagnosis happens, they probably have visited a facility or seen a health worker 6 to 7 times. Okay, so people are also going. So we must also not put the whole burden on the individuals. We have also to put the burden on the health system to say how capacitated is the health system at the first point of contact, able to catch the disease early and refer the person.
But that now brings the issue of wrong diagnosis.
There is wrong diagnosis, there is actually failure to diagnose, and also people may just be told, you have a cough, it's okay, just take this and go away. So there's wrong diagnosis, the failure to catch the actual disease. But there's also another problem of cost. So if you go to a facility and then you say this is what is going on, and the person you see, the health worker, tells you, we need to do a biopsy, we need to take a small sample, take it to the laboratory, so that will cost you 10,000 shillings. So go look for the money and come back. But a lot of the people, we know 40% of Kenyans or even more are living under $2 a day. So when you say go and get 5,000 and come, that person won't come back. They'll probably go say we don't have the money, and then what's the problem, I'll wait. Then they have a problem, they come back again. Then they are told, so there are all these challenges of the health system itself that's actually failing the people. Because if somebody has gone to a facility 6 times, how didn't we actually make the diagnosis and refer them on time? So the issue of cost of care is a significant one. We know that for diseases like HIV, TB, malaria, and some other diseases, there is significant funding from the government and from funders, donors, that actually provide free care. So, people with HIV don't pay for their medication, TB, malaria to a large extent, but there is no one funding cancer. Cancer takes only 0.5% of our national health budget. Only 0.5%. But the disease burden
from the summit, from the institute to upscale.
So this is the conversation we need to have, because if it is 10% of our disease burden is cancer, but you're only putting 0.5% of our budget on cancer, it means that we have a huge neglect there. NHIF, the National Health Insurance Fund, has come in. Last year, I think the data I see is that they treated about 50,000 patients, spent about 1.5 billion shillings. So a lot of cancer cases are being taken care of through NHIF. But this is because they only register for NHIF after they are diagnosed. It's not because they were registered before. So we need to scale up NHIF registration to everyone. We need to work with the counties to ensure that health services are available for free at the first point of contact. And this is part of the conversation we are going to be having here with the National Cancer Institute and the Ministry of Health.
So what are the figures do you have currently? Last 2 years, because the number continues to rise. What are the figures that do you have right now in your records?
So as a country, we see over 42,000 new cancer cases every year. Unfortunately, about 28,000 of them are losing their life. due to cancer and its related complications. So it is a major problem. It's actually the third leading cause of death in our country, just after infectious diseases and cardiovascular diseases. So as much as we are focusing on cancer, we're also talking to the general public that they also need to be screened for these cardiovascular diseases. You know, like hypertension is a silent killer. No one thinks that they have hypertension until they are sick, or you get a heart attack. So it is an important thing to look at. And then when we look at the cancer is the biggest mimicker. And that's why patients are presenting late. And even doctors sometimes are missing this diagnosis. It needs a very high index of suspicion from the grassroots. That when the patient keeps coming, if they come 1, 2, 3 times, you need to think twice that could it be, if it's not an infection, because most of the things will be infection or these cardiovascular diseases. Yes. So if it's not this, what else? Maybe it is cancer. So that is the time the doctor should refer this patient for specialized assessment. We encourage assessment. We encourage our counties to have specialized doctors in the counties. This will help support the clinicians, the GPs, in making a timely diagnosis of cancer, so that we don't have patients coming in tertiary hospitals at stage 3 and 4. In fact, if we look at our routine data from the hospital at Kenyatta, we see that majority of the patients are coming in stage 3 and 4, which is quite advanced stage. So we want these statistics to change. We pick earlier and earlier stages, and the chances of treatment and cure are higher, and the cost of treatment will be lower. But when a patient comes in stage 4, we are dealing with the complications of the cancer. You have to transfuse, they are anemic, they're in a lot of pain, maybe the cancer is bleeding, or it's causing obstruction, maybe to the food pipe, or even the urine is not passing well. So it is very key that cancer is cheaper when it's diagnosed early.
Let's before I go to the chief, let's just bring the myths that we have around. Anytime you receive a patient, or patients for that matter, can we just try to demystify that probably cancer, the way Chief was putting it, is a disease of the rich? You don't need to take meat, you don't need to take maize, you don't need to take this and that, this and that, this and that. Let's demystify that so that the common mwananchi should understand that cancer can be caused, it's not a disease of the rich, really.
Yeah, true. Cancer can attack anyone, even children, innocent children. They can get cancer. So if we look at the commonest cancers in our country, we look at breast cancer. In fact, the commonest cause of breast cancer could be genetic, the fact that you are a woman, you are growing older, the chances increase, or a positive family history. If we look at cervical cancer, which is number 2, it is actually caused by human papilloma virus. So you can get HPV infection whether you are rich or poor. So it doesn't choose. And that's why we're focusing on primary prevention by immunizing our young girls before they become sexually active and before they contract the human papilloma virus. We look at men. Prostate cancer is quite common, or is one of the leading cancers. It is not a disease of the rich. We see both poor and rich people coming to hospital, and this is caused by genetic factors and the fact that maybe the rest, it's common in the black people, growing older. It's a disease of aging, so no one can stop aging. And if we look at throat cancer and lung cancer, which is also common in the male population, the biggest cause is use of tobacco. So people who are smoking are not just the rich or the poor. Anyone, it cuts across. So people should not look at cancer being a disease of a defined group of people. They should look at it as a cancer that can attack you at any time and in or place. And it's important, if you're not feeling well and you've had several visits to a doctor, get a second opinion just to exclude cancer. Also, you have to be proactive to limit the use of tobacco, alcohol, and if you've not started using tobacco, then don't start, because it is It's a very big health risk factor. Obesity, a lot of excess weight, lack of exercise. These are things we can exercise.
Actually, it boils down to lifestyle diseases now.
Yes.
Yeah. All right.
Yes.
Chief, you've gotten your answer based on what you've said, the myths, the family issues. Somebody said that, we are to PYO, you get what I'm saying. But then when you go back to your level, the administrative bit of it, what is the response from the common mwananchi? Anytime you have the barazas, you have got community sensitization summits, what is the response and uptake on your drive to sensitize the mwananchi to go tested, get screening, so that we can prevent cancer?
I would agree that people believe us when we give positive message, true message, scientifically researched information, able to influence attitude change. And I would agree that at the grassroots level, we are seeing activities geared towards an understanding that we can do something about cancer. If we find people seeking for treatment, and you have success stories of people who have been screened with cancer and they have been cured and they are back to their life, and it's encouraging at the community level. What I may mention specifically in my area, we had the issue of these asbestos roofs, and there was a discussion before about that they could be causing, they have an agent that causes cancer, and we started moving now the roofs. You'll find that there has been activities, maybe government led, to remove even city council houses roofs that were asbestos, and we are replacing them now with the common mabati. You see, the people are embracing. They are accepting that you need to do something about preventing cancer. The other thing I would say is that when it comes to when we are telling wananchi you need to dry your maize until the water content is low so that you don't have a cancer effect. Now they seem to understand.
Yes. And
except now with the brokers and people who are doing for business, who may not have the luxury to go through that drying. The common mwananchi dries their maize naturally, historically, culturally, and before they take them to the mill. And you see there is a positive response to what you're doing. The biggest undoing is the herbalists and these people who come and put posters on poles and say that we can treat any disease. Dr. Mohammed from Tanzania, from Zanzibar, they really do us unfavor because they do not understand the process or the disease treatment, but they tell wananchi they have an answer, and you're trying to dissuade them from believing those people. We also have another, as I was saying before, people who believe that if I'm ill, especially among the Kikuyu, that because my mother dowry was not paid, if I pay dowry, things will change.
Yes.
And now they go to more of a cultural myths. They're thinking that this disease is in our family because we never pay dowry. And now they go to resources that we have been used to treat, now go to paying dowries in huge amounts, and you end up complicating issues. I would say that we are educating them, we are talking to them, telling them that this cancer is not about family curse. It is something that you can need medical intervention.
Absolutely.
And we are doing well.
Absolutely.
Thank you.
That's a very sad state of affairs because lack of knowledge. Even the good book says that my people will always perish because of lack of knowledge. But Dr. when you talk about the government's intervention to bring cancer centers across the country, you'll find that a majority of Kenyans will travel for long distance, either to go to Kenyatta National Hospital to see Dr. Githinji, and yet whenever they come from different sections of the country, either the counties, they don't have machines. And that is one of the reasons the government probably put a lot of effort to bring cancer treatment closer to the people. What do you think should be done at this particular point? We are in 2023. The summit is ongoing. Apart from the report that has been going on for the last 10 years or so, what are some of the deliverables do you think that you as a community, as a sector, can do to bring cancer treatment closer to the people?
Important question here, and I think, as we said earlier,
yes,
the most effective cancer reduction strategy is screening. So the first step is to screen. Even as we do prevention, all the things, removing what we call the modifiable risk factors, smoking, advising the people, reducing alcohol. Screening is the most critical thing, and that needs to be devolved to the primary healthcare. Health is devolved. It is the counties that need to say at every first point of contact, whether it is level 3 ability to actually do basic screening, depending on the levels of screening approved at every point.
Yes.
That is so important because the service delivery can then be supported through what we call a referral system. Because we don't need every county to have a center of excellence for cancer. We don't need every county to be able to do a PET scan, for example. We don't need every county to be able to do a cyber knife. No, we don't need that. Yeah. We need basic screening, identification of the stage and identification of the level, and then after that be able to create a hub and spoke or a referral system, because we probably have, I don't know how many Dr. Nyongesas we have. I think we estimate maybe 70 or so. I don't know, maybe Dr. Nyongesa has a better number. Right. So you can imagine we have 70. You can't have every county having all the needed oncologists or all the needed nurse oncologists or all the needed PET scans. So we need a referral system. But the most important thing is to screen. Because once you screen and pay for the screening, you'll be surprised. I don't think right now that actually in our National Health Insurance package, yes, we actually provide for payment for screening. I don't think NHIF pays for pap smear, for example. If you're a woman and, Dr. Nyongesa here said cervical cancer is one of the biggest killers for women. Yeah. But if you go and get screened...
The service already is available.
The service is available. Pap smears are available across the country. But who pays for it? You have to pay for it. You have to pay, you choose food over the pap smear. So these are the basic things we need to focus on first before we focus on centers of cancer. Then once we do the screening and we make sure that that is available to everybody, yes, then you support that with a referral mechanism. As we move forward, then increase the service delivery points, support radiotherapy, chemotherapy, referral, support also the cost of transport, yes, support accommodation. We had a huge crisis in Kenyatta National Hospital where, because you come and you have to wait, people don't know where to stay. All these are the things we need to focus on that are doable before even we go to investing in expensive equipment. Absolutely. In the cancer care.
Dr. you love to chime in on that, but what are some of the emerging trends currently? Yeah. Because cancer, it evolves. It appears on a daily basis, it comes in different shape, color, name it. But what are some of the emerging trends we have?
So, maybe let me talk about the intervention aspect.
Yes.
As a country, apart from investing in national referral centers, I can mention we have Kenyatta University, Kenyatta National Hospital, Moi Teaching and Referral Hospital. Those are the national centers with higher specialized equipment. We also have the county chemotherapy administration centers, about 10 of them, and this has reduced the burden of cancer patients having to travel all the way to national centers for that kind of care. Yes. And in another setup, we see that NHIF, there's a lot of enrollment on NHIF to take care of these cancer patients. And I would say, like at Kenyatta, I think over 90% of the cancer patients are using NHIF, and we're really grateful to NHIF for this initiative. And I would encourage as many people possible to enroll on this scheme. It helps patients. And then in terms of treatment, cancer treatment is not just radiotherapy machines. Yeah. It is actually, it involves surgery, it involves chemotherapy. Radiotherapy is just one of the treatments. And if we focus on early diagnosis, you may find that even surgery can be done in the county. That's early stage, and the patient may never need to travel to national referral centers for radiotherapy. And in terms of development, we're looking at building capacity. As you mentioned, we have very few oncologists. So we have universities which have actually picked up. I can just name a few more. University, Nairobi University. For the first time, we are training radiation oncologists, and the first batch is due to graduate in less than a year. So this will increase the number of clinical oncologists we have in the country. KMTCs, they are training clinical officers in oncology. We have oncology nursing training going on. Tuku University is training medical physicists. We never had this in the past. Yeah. We are also, as a country, training radiotherapists. Before doctors or physiotherapists, physicists, RTTs, oncology nurses had to go overseas for training, but now this training is available locally. Yeah. And in terms of also preventing cancer, I think as a country we need to focus a lot on education. Educating our children will arm them with information which they can take back to their parents. Tell them that, Mom, you need to go for screening. Dad, I see you're not well, you need to go for screening or treatment. So all those things, it is really multi-sectorial. We're just not focusing on infrastructure, we are focusing on human resource and also focusing on empowering the community so that they are more aware. Yeah. And together we can win the war against cancer. The success stories of the cancer patients that we've treated, and they are surviving. I think that keeps me going.
That's quite important, the success story, because many people always think that now that you have cancer, it's a death trap and your case is closed. Yeah. All right, let's take a break and we'll come back. We are still going to continue this discussion because cancer is a menace as we speak. From the experts themselves, it is one of the leading causes of death right now in Kenya. But can it be prevented from them? Yes, it can. Let's take a break. We'll be right back with more after this.
Welcome back to the program. You're still on Good Morning Kenya, live from the Safari Park Hotel, where the National Cancer Summit is underway. In fact, it's just begun, still ongoing, and this particular summit is supposed to be taking place between today and 4th. That is 2nd to 4th. It's going to be a 3-day summit, of course, organized by the National Cancer Institute. Just where I am is currently outside Safari Park Hotel there, where there's really quite a lot of activities ongoing, and momentarily I'll be speaking to the Kenyans who've made way here to just understand what exactly their expectations are in regards to this specific summit. We've over time talked about how cancer still is the 3rd leading cause of death in the country, and this is after cardiovascular diseases and infectious diseases, and this is why it has also become necessary for NCI to organize this particular summit. In fact, the first of its kind, to just look at the cancer response in the country, the cancer burden in the country, and how to come up with better ways to alleviate the burden that is cancer. So far, quite a number of issues have been proffered, spanning down from the treatment of cancer, looking at late diagnosis, screening, and how to deal with all of this. And just again, when it comes to treatment, looking at how expensive it has become when it comes to the treatment of cancer. Of course, you've seen how NHIF has played a role, but even at that, we are still looking at how expensive it is, or it has become, when it comes to treatment of cancer. So that is part of what this summit is also going to be looking into, to look at how and where we are as a country as far as cancer response is concerned, where we are in terms of diagnosis and screening, and just how we can be able to bridge that gap, particularly when it comes to diagnosis. When you look at most of this cancer, we've again talked about the fact that early diagnosis, early detection will definitely lead to better treatment and early treatment. So again, this is just basically why you're seeing, Kenyans streaming in large numbers. So far, good number of them are already inside the hotel. And again, this is in regards and in respect to this summit, which, as I said, will be taking place between today and the 4th. And also, quite important for me to mention why this summit will be culminating on the 4th of February, which is actually on Saturday. And this is because of the World Cancer Day, which is oftenly marked or normally marked on the 4th of February. So this is also the reason as to why this specific summit summit will be culminating on the 4th. That is on Saturday. And I also just want to get a feel of Kenyans on really what exactly they are expecting. But of course, we'll be doing that momentarily. We are here all day to give you bits and pieces of how this event will be unfolding, and also we'll be heading over to Victor to continue with his panel of discussion. And again, we'll be coming back here to definitely get a feel of Kenyans, because they are the ones who do bear this burden, whether it's one who has been diagnosed with cancer, or it's a caregiver, or even a spouse of someone who's suffering from one form of cancer or the other. So we will also definitely want to get a feel of Kenyans in regards to what really exactly they expect from this summit, and what exactly they also expect various stakeholders to do, and definitely also the state in regards to bridging the cancer burden, and more so the cancer treatment. But before we get to do all that, Victor, what more do you have with your guests?
All right, thank you so much. That is Doreen Range at the registration center for that particular report. And by the way, the function is also happening at Kasarani Primary School, so you need to head there and get to talk to the experts and understand what is needed as far as cancer, the fight against cancer in Kenya is concerned. All right, welcome back. Now, let me come back to you, Douglas, who is our area chief now. Let's talk about the issue of capacity building in our local communities. What are you doing at your level?
Basically, at our level, we have the universal healthcare programs.
Yes.
That have been launched in the previous government, and we're able to do household mappings, ensure that every household is covered with a community health volunteer who is able to link them to level 1, level 2, and level 3 hospitals, which we have several in our areas.
Yes.
You see, like now the county government is doing dispensaries and maybe health centers at from level 1 to level 3. And at least now the burden of patients going all the way to Kenyatta for treatment or even screening, now they can do it nearer home. The other intervention that we are undertaking at the local level is to ensure that people register for NHIF, so that every family is NHIF covered, because that enables the family to reduce the burden when they are hospitalized. Maybe when it comes to now daily going to hospital, you realize that it may be a little bit costly for them.
Yes.
But in case someone is admitted, NHIF comes in, and that helps us to reduce the harambes that we do, the social media WhatsApps for raising money for paying, and maybe you realize also people have been detained in hospital. We are doing awareness at that level. We have also recently we were taking like Kenyatta University Referral Hospital doctors to the slum at Soweto to talk with the community, so we're able to engage, tell them that demystify, that was a breast cancer month, and demystify that you can also do self-screening, and there are things that you can do to identify whether you are also at that risk. And as you are talking with the community, you find there is uptick. Now, the next time we had a breast cancer event, you see wazees or even old women coming there, and before they used to ignore that. Those are the main major activities. Then when it comes to maybe increase of coverage,
yes,
and outreach, you find like we have now the Community Health Center. Community Health Center, okay, is able to serve the community, and we have another one at Gitahi, another health center, level 3 hospital.
Yes.
We have the Kasarani, we have the Githahi, and it is just within walk. You don't need to go very far to see a doctor like before. And that is what we're trying to do to reduce, especially in the urban areas. The rural areas, we go to do still more to take community health at the grass, because you don't need a hospital, you need maybe a community health worker at the local level.
Absolutely.
At the chief's baraza, talking to people, and they're able to answer questions and refer when need be.
Okay.
Thank you.
All right. Let me come back to Dr. Githinji now that you're almost coming to a close. There was a cancer task force report, and it's out. I'd like you to give me maybe 1 or 2 deliverables or some of the recommendations they're trying to implement right now in the fight against cancer as we come to a close.
Yep. So thank you very much. This was a report which was instituted by the Ministry of Health through the Cabinet Secretary, and they wanted to understand the state of cancer, what the challenges are, because as you can hear, it's a very complex situation. The report was handed over, and the key recommendations were grouped into kind of 6 areas. One was health workforce. Do we have the necessary health workforce or health workers to deal with this problem? Secondly was, do we have the necessary financing, and how do we finance cancer? Number 3 was around the products, what we call health products and technologies. Are these available, as you were asking earlier? Is radiotherapy, chemotherapy available? And then the other thing was about what is their costs? There were challenges that were seen to be challenges of stockouts, for example, very expensive care. There was also the issue about data. Do we collect enough data? Do we have a national registry that can tell us where cancer is going, which cancers are growing? Kenya does not have what we call a population-based cancer registry. We have kind of hospital-based. So that was a big concern. The other concern was actually the governance, the leadership and governance of the cancer environment. And that is why there was a constitution of the board of the National Cancer Institute, which was created by the Cancer Act 2012, but the board had never really been constituted. So we came into being about July or so last year. And then there was an issue around just multi-sectoral coordination. So these were the things. So already you can see the board is in place. That's why the National Cancer Institute is now hosting this summit. We are in place. We are now taking care of that. The National Cancer Registry is in place. We are looking at how to constitute centers of excellence in the counties and constitute what is called tumor boards to discuss cancer at a local level and bring experts together to discuss this. There is also the issue of developing the necessary human resources. Dr. Nyongesa has talked about the work going on to increase training of cancer resources. And there is the issue of financing, ensuring that the package of care for cancer for NHIF is expanded to include screening. So there are many recommendations, and these are now going to be tabled at this summit as well, discussed, so that at the end of tomorrow, this summit will have discussed the recommendations and said, let us prioritize the following and let's move on this way.
Dr. Rick, your final remarks. What are the success stories?
Yes, cancer is a disease like any other disease, and if one has been diagnosed with cancer, do not fear, have hope, and there are research and standard treatment recommendations. So don't waste so much time on herbal treatment. At the end of the day, the doctor treats and God heals. We embrace the church in praying for the patients, yes, but let them seek approved conventional treatment from the hospitals. And with that, we've had a lot of success stories. As I said, over 30% of the cancer patients that are being diagnosed every year are surviving, and they are living testimonies. We want to improve this cure rate to a higher, even reach 100% in the near future. And with all these concerted efforts, I think we are going to make it. And let patients, when they are diagnosed with cancer, let them not waste time on, they are told, don't take gluten, don't take meat, don't take this, just take wheatgrass. All those are not like standard treatments for cancer. Just go to hospital. If it's surgery, you'll be done surgery. If it's chemotherapy or radiotherapy, these are research treatments, even in the US, in the UK. And we are not reinventing the wheel. We're actually using approved treatments which have been researched and shown to be successful in terms of improving the survival of the cancer patients and also in providing cure.
Thank you.
But the key is early diagnosis improves cures.
Asante. And Chief, what should you expect today? We are in your locality.
Today we are expecting to raise our discussion at a higher level, so we're able to raise the awareness so that the whole nation can understand how to go for screening, how to prevent cancer, how to manage cancer, and the benefit of knowledge rather than from living in myths and misconceptions, and especially the phone, the social media. It is actually doing us harm. We need to change the story so that we can positively tackle these menace and we can overcome. Thank you.
Absolutely. All right. Thank you so much. That brings us to a close on this particular discussion, but stick around because we'll be back later on. We've been talking to Dr. Githinji Gitahi, who is the Group CEO, Amref, and Chair of the National Cancer Institute Board, as well as Dr. Nyongesa, who is the oncologist, cancer specialist, head of of Department Kenyatta National Hospital Cancer Treatment Center, and with over 15 years on managing cancer patients. And finally, Douglas Kimani Mwangi, who is the Assistant Chief, Kahawa West Sublocation in Kasarani. We are taking a break, taking it back to the broadcasting house. Later on, we'll still be having this discussion when the summit will officially kick off here at the Safari Park here in Nairobi. Stick around, we'll be right back later on. Good morning.